Good morning, everyone. We'll give everyone just a couple more minutes to let people enter the meeting room, and then we'll begin. Good morning, everybody. Welcome to the 2022 Kansas City Physical Activity Summit. We're so pleased you could join us on this beautiful fall, late September day. This is going to be a great morning of conversation and discussions around how we can make our region to create more opportunities to be active in our region in both safe and equitable ways. We've got a really full program, but before we get started, I'll just share some quick housekeeping instructions. First of all, the program for today's meeting can be found on our website. And Katie from Children's Mercy is going to throw this link into the chat, and you can download a copy of our program that has an agenda, speaker bios, and sector-specific information listed. This meeting is being recorded. You should probably have received notification of that already. During the main sessions, like what we're in right now, we ask you to mute your computer. You're more than welcome to turn off your camera during the main session if you'd like. But when we move into breakout sessions, we would like you to turn on your camera. Additionally, we want to make sure that your screen name includes both your first and last name, and you can use your include your organization as well in there if you'd like. If you need to rename yourself, you can go to the little box that has your video in it, and up in the upper right there should be 3 little dots, and you should be able to rename yourself right there. That's important to have your first and last name so we can assign all the breakout rooms correctly, and that when we're having conversations, we know who we're speaking with in the breakout rooms. Speaking of the breakout rooms, we've got 2 great breakout sessions, and each session has 5 breakout rooms. You've already been assigned a breakout room based on some questions that we asked during the registration process. You can check your breakout room assignment in the link, the Google Doc, and Katie will throw that in the chat box in just a second. You can check your assignment. If you would like to switch rooms, that's okay. However, you're automatically assigned. So please type that into the chat saying, hello, I would like to move from access to programming or something like that, and we'll try to get you switched over. I'll talk more about the breakout sessions in just a minute. Oops. We want to thank our sponsors for this event. The Kemper Foundation has been a tireless supporter of the Kansas City Physical Activity Plan since the beginning, and their support is, it makes this event possible. We also want to thank the Health Resources and Service Administration Region 7 team for their support as well, and we would like to thank Children's Mercy for their support. I want to thank a few individuals. Sheila Kemper-Dietrich from the Kemper Foundation, Maisha and Rich from HRSA Region 7, Sheila Montgomery from Children's Mercy, the Wichita State Community Engagement Institute, who you're going to meet in a little later in the program, and Tico Productions. They are providing all the AV support for our summit today. So thank you very much. This work is the result of a lot of hard work from our core work group for the Physical Activity Plan. That group includes Carol Thompson, Bill Brandmeier, Jordan Carlson, Jody Dickmeyer, Rhonda Erpelding, Jennifer Jute, Richard Overcast, Toriana Porter, Adrian Roberson, Melinda Shahane, Allison Smith, Laura Steele, Robin Stewie, and Reverend Eric Williams. And then last but not least, I'd like to thank the members of the Weighing In team. My name is Robin Shook. I'm the director of Weighing In, and Weighing In provides the backbone support for the Kansas City Physical Activity Plan and for this summit. The rest of our team is Shelly Summer, Katie Imey, Veronica Vidal, Litany Supkick, and of course myself. So here's our agenda, and again, you can find this agenda online, and Katie's pasted that link in the chat box. The first thing that we will do is have a keynote presentation from Dr. Bill Kohl. I'll introduce him in just a second. Then we'll move into highlights from some of the sector work that has been done. We'll have breakout session 1 at 10 o'clock. We'll have a physical activity break at 10:50, breakout session 2 at 11 a.m. And then we'll share back at 11:40 and close out by noon today. So just to give you a real quick overview of the Kansas City Physical Activity Plan, for those that this is new or for those that need a little refresher, we started this work in 2020. This is based almost exclusively on the National Physical Activity Plan, and Dr. Kohl's going to talk more about the national plan during his keynote. The Kansas City Physical Activity Plan is a comprehensive, multi-sector collaboration working to foster a culture of active living in Kansas City. And our goal is to create safe and equitable opportunities to live an active lifestyle in our region. And the plan is the big thing. And then within the plan, we have societal sectors. And within those societal sectors, there are strategies, which are kind of broad initiatives, and tactics, which are more specific actionable items that, if implemented, would result in increased levels of physical activity. Ultimately, though, it all depends on implementation. So what have we done so far? Well, in the past 2 years, we've held 194 meetings. We've developed 10 societal sectors. Within those sectors, there are 34 strategies and 110 tactics that we've developed. And now we are moving into the implementation phase. And you'll hear more about that during the breakout sessions and in some of the sector summaries. So, as I mentioned, the goal of the Kansas City Physical Activity Plan is to create Kansas City-focused, sector-specific strategies and tactics to foster a culture of active living. By doing so, we're making a statement that physical activity is a public health priority in Kansas City. We are developing, through things like today, a multi-sector coalition to advocate for priorities. This is not just Weighing In that's doing this work. This is not just Bike Walk KC doing this work. This is a whole host, almost 100 organizations that are active in this work. And we're creating a framework for implementation of strategies and tactics that can be done by anyone. It could be done officially through the Kansas City Physical Activity Plan. It could be picked up by some other organization that's not even involved, but they decide to implement it on their own, and that's just fine. We also have 3 overarching priorities. One is we want to increase local funding for physical activity in our region. We want to do regular comprehensive surveillance of relevant physical activity metrics, and we want to report out on those physical activity metrics on a regular basis. We've published several documents. Those are listed on the screen. The ones that I encourage you to read are the one on the left, the 2020 Regional Report Card on Physical Activity in Children and Youth. Katie should be throwing that link in the chat. And then the document on the right is the actual Kansas City Physical Activity Plan that has all the strategies and tactics and sectors listed. We published it a little over a year and a half ago. We're going to release the second edition later this fall. So the goals for today's meeting is to transition from strategy and tactic development within the plan, which we spent the past 2 years doing, into implementation of strategies and tactics. And you will hopefully notice in our work, and hopefully it comes up in the discussions today, that to really make change, we need multi-level and cross-sectoral work. And when I say multi-level, I mean things acting on both the individual, the interpersonal level, the organizational level, the community level, and the policy level. And I guess one last thing I'll say on the cross-sectional work is we've intentionally designed the breakout rooms to include people from lots of different societal sectors in them. So it's not just going to be infrastructure people in one group and education people, schools people in another group. Everyone is mixed, so it's designed to be cross-sectional. Specific things that the facilitators will help guide the discussion around are strengths, opportunities, aspirations, and how we will measure results around these breakout topics: access to physical activity policy, physical activity programming, and physical activity professional development and education. And to help kind of kick the day off and really set the tone for what we'll be talking about for the rest of this morning, we have an excellent keynote speaker, Dr. Bill Kohl. Dr. Kohl has been probably the first champion of the Kansas City Physical Activity Plan when we started in 2020, and he's been a tireless supporter of our work. He is the current chair of the National Physical Activity Plan. He is the professor of epidemiology and kinesiology at the University of Texas School of Public Health, located in Austin. He has a very distinguished career. From in the early 2000s, he worked for the Centers for Disease Control and Prevention, specifically in the Division of Nutrition, Physical Activity, and Health branch. In his more recent efforts, he's focused on national and international physical activity, surveillance and epidemiology. He created the state plan, physical activity plan for Texas, Active Texas 2020, and is currently developing the next version of that, Active Texas 2023. He has published over 270 papers. He is the editor emeritus of the Journal of Physical Activity and Health, and he's just an all-around good guy. I'll also say that I've seen tweets that show him presenting at some of his work while barefoot. I have no idea. I can only see his head, his shoulders and head today, so I don't know what's on his feet today, but perhaps he's barefoot today. And so with that, we'll turn it over to Dr. Bill Kohl.
Well, thanks very much, Robin. I'll just have to leave everyone guessing whether or not I've got shoes or anything else on below the waist today. That's probably too much information. It's an honor to be here, join you today, and I looked at that very nice introduction you gave, and probably the thing I'm most proud of right now is the fact that I've been an early and strong supporter of your work there in Kansas City. I think it's incredibly important to bring things to the local level and get things done. And that's what I hope in the next few moments to be able to highlight the national plan and to be able to share some, I think, hopefully some good news, some progress we've been making. So with honor comes responsibility, and my first responsibility is to try to share my screen here. Like magic, we have it. Anyway, I'm very impressed at the coalition you've built there in Kansas City, from you know, the sponsors, the work group that you have put together, as well as your team. It's the way to do things right, I think, and that's one of the reasons why I continue to be involved and watch the progress, hopefully in a small way helping. Anyway, what I'd like to try to do today is, let's see, video check. Robin, can you see screen? Are we good? Okay.
Yeah, it's looking good. Thanks.
What I'd like to do today is not take away from the important work that's happening with your work groups and breakouts, but kind of give some background if folks here don't know about the U.S. national plan. It's what the Kansas City plan is based on. And then give an overview of what we're trying to do at the national level, and update with some new data, some new information. I think it'll be inspiring, at least it was to me when I saw it last week for the first time at a training course we run in South Carolina. So let's jump right in here. The national plan, like the KC plan, but it's meant to be a comprehensive set of policies, programs, initiatives that are designed to increase physical activity. You know, I'm a big believer in public health. I'm a big believer in planning in public health, because you don't know where you're going to go unless you have a plan. And I firmly believe that you don't know when you get there unless you have a plan. So setting goals and objectives and strategies and so forth to achieve those goals is really kind of critical. Ultimately, we want to, all of us collectively, I hope, but from a national level, want to improve health. We want to make things more equitable, more access to physical activity, and enhance quality of life for participants and Americans throughout the states and the territories. Just a little bit of a brief background here to see the evolution of this. The KC plan, as Robin indicated, was first published in 2020. There was an awful lot of work leading up to 2020 that Robin and the group put together, but at the national level, we got our start in about 2007. So it's been quite a while getting these things together. I think that emphasizes how much work and how rapidly the Kansas City plan has come together. But some coordinating committees were built. The development of the first plan began in 2008. The first took a couple of years, and then kind of revision 1.0 of the plan was released. The National Physical Activity Plan Alliance, a 501c3 nonprofit, was established 3 years later. Again, an organization wholly dedicated to the public health approaches to physical activity and health. It was kind of a unique milestone, I think, in our development. We realized 4 years after the first one came that there were some things that needed to be changed and updated, and different approaches and so forth that needed to be looked at. So the revision for 2.0 began. And then bringing together, much like what's been happening the last couple of years in Kansas City, a summit to have breakouts and to talk about strategies and tactics and the like in DC in 2015. Updates occurred, and then in 2016, version 2.0 was released, a full 6 years after the first edition, the first version was. And then since then, there's been quite a bit of activity. Most importantly, I think, the nonprofit alliance here that was established in 2013 merged with the National Coalition to Promote Physical Activity, as well as the Physical Activity Society, to come together to bring all the national organizations together and form the Physical Activity Alliance, which is the organization in which the national plan resides. I think it's a great step forward. It makes things easier to follow. It gets the different initiatives nationally talking with each other, and allows for coordinated progress going forward, from everything from influencing things on Capitol Hill to training and extending our infrastructure for professionals in the area, and working the plan as what we're talking about here. So been quite a bit of activity. It doesn't just get dreamed up. It didn't just get dreamed up one night, in other words. And I have to have a shout out to Dr. Russ Pate, who is at the University of South Carolina, who's a grandfather of all this, and has done a remarkable job at helping this evolve to where we are now. So taking a look, this will look very familiar to those of you who know the Kansas City plan. As I said, it was based off of the U.S. plan, U.S. National Physical Activity Plan. And much like in Kansas City, there are overarching priorities. First is to develop a CDC office dedicated to physical activity and health. Recent information show that population-level physical inactivity is as important as smoking from a public health standpoint. And there's an Office of Smoking and Health. Why don't we have our own office that focuses directly on physical activity and health? That requires a lot of work at a budgeting level and so forth to make that happen, but that's an overarching priority. Increasing surveillance, you'll notice that that's similar to what measuring progress here, similar to what is in Kansas City. Developing report card or periodic report cards to take a look at progress. Developing policies, increasing funding. And right in here is where Kansas City fits, as well as Texas and West Virginia, as the two states, the only other two states with standalone physical activity plans, is emphasizing and working to get translation from the national level to state and local. So once, if the working group gets lost and we wonder why we're doing this sometimes in Kansas City, into this national plan and what the overarching priority is to articulate the work to where it has to happen, which is at the local level. Robin talked about societal sectors, and I'm sure many people are familiar with it, but the national plan has 10 sectors. All of us, every one of us interacts with multiple sectors each day: education, healthcare, transportation, parks and rec, public health, business and industry. We don't live in one bubble. We cross multiple sectors, And that's what the approach to changing physical activity and improving physical activity has to be. It has to be a systems approach. So there's sectors in the national plan that deal with mass media, public health, education, healthcare, sport and recreation, business and industry, faith-based settings, recreation, fitness and parks, and then a big one, transportation, land use, and community design. Importantly, in the last year, the national plan has added a new sector that details specifically specific approaches and plans for strategies, tactics, and objectives to increase physical activity in military settings, veterans, recruits, military families, communities that host military bases, those kind of things. And that was debuted in not too long ago, August or July, I believe. And it's a great step forward, I think, for what we want to try to do with the national plan. So 10 sectors, six overarching goals for the national plan. Here's an example. I just picked one out that's a highlight in business and industry. The rationale, evidence-based, making the case that businesses can be more successful if their employees are healthy. They are a leader, obviously, with the large employed population throughout the country to coordinate and support and sustain such things. And then there's data about national healthcare expenditures, the role that physical activity plays in mitigating or preventing non-communicable diseases like heart disease, cancers, diabetes, metabolic diseases, and the like. And more acutely to businesses in general, physical inactivity has been shown to be associated with lower output, lower worker performance of all things, and in addition to all the health-related things. So you make the case at each of the societal levels, and I think this is what, when you all are pivoting now, you've got the case made, but leaning on this kind of information to make the case for implementation is I believe, a winning strategy, and I hope to see that come out of your group meetings today. Underneath that, there are strategies. This is, again, the example from business and industry. We provide opportunities and incentives for employees. These are evidence-based strategies. Sometimes they're aspirational, as Robin indicated, but they are evidence-informed or evidence-based about ways we might be able to attack this. And there are 5 kind of key strategies in the business and industry. Advocate for policies, surveillance systems, the business case for physical activity promotion. So you can, and this is all, and it's nothing new, I'm sure, to this group, but it is all on the web. But underneath the strategies, as in Kansas City, there are tactics, and these are examples. So in other words, in the strategy for incentivizing healthy lifestyles, a work site may conduct periodic health screenings that actually focus on physical activity or physical fitness. And that's their way, from a strategy standpoint, to say this is important. This is important for your health. It's important for our company. And we're making this a priority. In advocating, for example, we might create a policy resource that helps people see policy ideas and examples for best practices in the work site. What does the literature say? All of us don't have time to get into the literature and pore over the literally hundreds of thousands of research papers and things in this area. What the planning document helps people do is distill that into things that might be able to be helped, might be able to be attacked, the low-hanging fruit, if you will. And then underneath each tactic are specific objectives that come out. I absolutely, and I'm walking the walk here in Texas because we're trying to put together, revise our Active Texas 2020 plan in an Active Texas 2030 plan. I absolutely believe that it has to happen locally. I don't even think a state plan is enough. If you think about a state as diverse as Texas, from 1,200 miles of border communities and very rural areas to 4 of the 11 largest cities in the country in Texas, they all have different needs, different objectives. And so I constantly beat the drum that all health is local. And I think that's one of the huge benefits from Kansas City, the Kansas City effort. You are, and your work group has representatives from the sectors and so forth that are in the local community. Your partners are local partners. That's something that the national plan can't and will not ever do. But because state and local planning is one of the overarching priorities, the work you're doing in Kansas City matches up with this just perfectly, I think. So we're reminding ourselves that all health is local, in particularly physical activity as a health indicator, is an important touch point for me, certainly, when I get lost in some of the sea of information we have. Priorities, cultures, resources differ. A focus on health equity is a cornerstone in public health, and making sure that the underserved populations have every bit of it, access to resources the same as other populations do, is critical for success. That's going to change, whether you're in Wichita or Kansas City or any of the rural Kansas out west. They're going to be different. I think Kansas City's work is leading, and can be other communities can pattern off what's happening and develop their own priorities, take into account their own cultures and resources and the like. Cookbook approaches are just destined to failure. I will not join today and tell you just follow the national plan, it's going to work. I think what Robin and his group have been able to do, and your work group and your community partners, is tailor the national plan to what has to happen. All of the sectors in Kansas City didn't come online at the same time. Funding, your generous foundation funder didn't come online for quite a while. And so navigating this and not following an exact recipe, I think, is the way to succeed as you're going there in Kansas City. I can't stress this enough. The leadership that weighing in and the group at the hospital have done to take the point on this, to figure out where there are no breadcrumbs and mark the trail going forward is absolutely critical. Finding leadership, motivated leadership, and keeping the leadership close is critical. And you've got that ingredient there in Kansas City, that all local efforts, state and local planning and this is in general for public health, but specifically physical activity in general, public health plans need to, I believe, follow these ingredients, or use these ingredients. And specifically for physical activity, I remember very early on, they say, well, why do you need a physical activity plan? We've got an obesity plan. And it just makes my chin cringe a little bit when I hear that, because physical activity is so much more than obesity. Physical activity is so much more than heart disease. And if physical activity as an important health indicator or a health outcome in and of itself can get its act together, other chronic disease plans will benefit. It's just not enough anymore to say, well, go out and get more exercise. We know that's not the way to do things. Our good friend Jim Salas, who has talked with this group before some years ago, always says it's fairly straightforward to teach someone to swim, but if you throw that person into a raging without any feasible way of getting across that river, that person's not going to be as successful as if there was a rope across it, or a bridge, or a boat getting across. So I honestly believe that the standalone physical activity plans will, in and of themselves, be important, but they'll also supplement and prop up traditional chronic disease plans for non-communicable diseases, try to attack those problems. So what are we doing in the national plan currently? I went through that timeline a little bit. First, we're updating the strategies and tactics. We call it a light touch update. 8 of the 10 sectors have now, in various forms, taken a look at their objectives, looked at the current literature to see if anything needs to be changed or added. It's not a heavy lift update, but it is something we're asked each of the sector committees to meet, review, and see what can be shined, if you will, in the next couple of years. So I'm pleased, and because the military studies sector has just come online, that one's taken care of. So really 8 of the 9 previous existing sectors have already completed their work. They're in various forms of completion, but the reviews have been completed. So look in the next 6 months or so for some updates to the national plan strategies and tactics and objectives. Like I said earlier, how will you know if you get somewhere unless you have, if you don't have a plan? And that's evaluation. I think that that's going to be a critical thing in Kansas City, but it's also a critical thing in the United States at the national level. What do we look for? I present as an example, some new evidence from the healthcare sector at the national level. This was just presented a few weeks ago at one of our meetings and is being prepared for publication. But this is, if you drill down into the healthcare sector, their first strategy is to increase the priority of physical activity assessment, advice, and promotion in the healthcare setting. Great. I don't think anyone would argue with that. It's surprisingly difficult to do, but I don't think anyone would argue with the importance of that. In there, underneath that strategy, one of the tactics is to make physical activity a vital sign. Just like when you show up at the doctor and your blood pressure is taken, or your heart rate is measured, or your temperature is taken. Making physical activity assessment a vital sign such that all healthcare providers assess and discuss this with their patients. It doesn't have to be a physician, be a nurse practitioner, but changing that culture to make it every bit as important as the things that are routinely measured at office visits would be a big step. This group recommends as a tactic to be a big step. And then they have an objective. It was clearly stated that by 2020, at least 2 nationally recognized healthcare systems that combine and served at least 10 million lives will have developed a standardized and validated approach to assess and document aerobic physical activity in children, adults, and older adults. Well, it sounds very specific. And it sounds, wow, 10 million people, how are we going to do that? I'm pleased to say that objective has been met. Kaiser Permanente in California, throughout the state, has implemented in their electronic health record a set of questions on physical activity that you can't get to the next page on until you have the patient answer. And Intermountain Healthcare in Utah has done the same. Combined, they cover many more than 10 million lives. And so think about the multiplier effect of simply having those questions asked on every healthcare visit. To me, that's an enormous step forward. This is what we're talking about, evaluating progress. And I think as you in Kansas City pivot towards implementation, thinking about how to evaluate that implementation, I hope it will be as part of your discussions today. How are you going to measure your success? Because you will succeed. I absolutely believe that. This is one example using the healthcare setting, but right now we're doing this throughout the plan. And I do have a bit of good news. This is a slide that was shown last week at the training course I was at. And I hadn't kept up with this, but these are national data about the prevalence of people who were classified as not getting any physical activity to speak of. Maybe some people getting some physical activity, but not meeting guidelines of 150 minutes each week of moderate intensity activity each week. And then people who are exercising at or above 300 minutes each week, the high level, the high point of the guideline. And I'll go backwards here. That group here has hovered around 15% really since the late 1990s through a couple of years, 3 years ago, I guess, 4 years ago, I guess now. But they met at least 300 minutes of physical activity. The gray here is people getting insufficient activity. It's kind of remained the same, nice and level, if you will. But take a look at what's happening with the black, which is the people here who are inactive, the black line here, beginning right around, I don't know, you can make the case that between 2007, 2008, you might have seen a blip here, but look at the trend that continues down through 2019 from, I don't know, approximately 37% of the population who are inactive, now down around 25. One aberration is maybe a blip, but if you can see this continuing trend, it's really kind of impressive. Now take a look at the people who are actually meeting guidelines, this blue line right here. I think something remarkable is happening, and I want to leave you with this great set of news, because I think there's things are changing. Beginning in 2008, I don't know that it's a coincidence, but I'll take credit for it. When the 2008 physical activity guidelines were released, we've seen this continuing upward trend. It's not necessarily overwhelming, but this continuing upward trend of people classified as meeting guidelines. That's remarkable to me, that we've been able to document this. It's not just a blip, 1 or 2 years, but this continuing trend where we were, I don't know, 26% or so in 2007. Now it's over 37, 38% of the U.S. population who are meeting guidelines from this National Health Interview Survey. It's a surveillance system. It's prone to misclassification on all the caveats, but this trend you can't deny. And as you talk about ways to increase your surveillance in Kansas City, figuring out ways to document your success and maybe what's going into that, I think is absolutely critical. So I think it's a bit of good news on the horizon. We have to keep going. We can't just be satisfied with 37% of the population meeting guidelines, but I think it's a very impressive first look at some positive news. And then finally, we're planning for National Physical Activity Plan 3.0. In 2 or 3 years after the dust has settled on the light update, the shining, as I call it, we're going to go through a substantial revision, open the hood, take things apart, see where we can improve, those kind of things, to keep things current with the current literature. I think it's important to rely on evidence-based and evidence-informed strategies and tactics to continue. So if you're not familiar, please visit us, the national plan at paamovewithus.org. Again, this is the Physical Activity Alliance's website. You can take a look at all strategies. We haven't gotten the military setting sector thing up yet, but it's getting close. You can take a look at all the sectors. When in your discussions, you think about implementation going forward. There may be some resources on the national side that can help you move forward in Kansas City. I want to thank you, Robin, and thank you all for being here. We got some time for questions, I think, and I'll turn it back to you.
Well, great. Thanks, Bill, Dr. Kohl, excuse me, for all the great updates. Good to see some positive changes in physical activity levels on a national level. I mean, you know, it's when you see a couple percentage point increase, you think that's some millions of people, and then when you see 10 percentage points, you can really see that change is being made. I think that's great. So we'll open it up to questions. You can use the Zoom feature to raise your hand. You can put a question in the chat box, or you can try to unmute yourself. Just be respectful from talking over other people. And while we do that, I'll kind of start out. One of the biggest challenges we face on the local level is competing priorities within our region. So obviously, violent crime is a problem in a city. Homelessness is a growing problem. Kansas City has long historical issues with racial segregation that go back to discriminatory housing practices that are still being felt across all of society. So what do you say when you're meeting with a decision maker and they say, well, I know you like physical activity, but we've got these other things that are more important to us?
Yeah, it's a great question. I don't think it's an either or proposition. For example, sector-based approach in transportation, land use, and community design takes into account safety. It takes into account equity, access, that people who are interested in solving social problems, which we have substantial, can agree that there are common solutions. Oh, by the way, creating a safer neighborhood with traffic calming procedures will not only improve motor vehicle accident prevalence or incidents and so forth, but it'll also make people safer and feel like they can walk in a neighborhood, for example. That's one thing. Making things, green space, more available to places, neighborhoods that haven't historically had infrastructure. The equity question, inserting parks, planning for parks, upgrading parks. We know that green space is associated with more physical activity, but it's also associated with more quality of life, neighborhood engagement, social capital, things that are absolutely critical to help solve some of our social challenges. So I don't view it as an either-or proposition. That's one of the beauties of a sector-based approach that you're taking there in Kansas City, nationally, and so forth. Is, as I said when I started, we all live in multiple sectors, and every one of these sectors can be used not only for physical activity improvement, but for improving health in general. And so I'm not going to say the physical activity plan will solve all of our social concerns, but many of them overlap with things that can be done to improve our social problems.
Any other questions from anyone in the room? Yes, Jason, go ahead. You can unmute yourself and ask your question. Let's see, can't hear you, or at least I can't, Jason.
I don't hear him.
Oh, there you go.
Is that better?
Yeah.
Yes.
So I know Kansas City has a lot of other initiatives that they're trying to solve. My question would be, would presenting something like this, would that help say, hey, you know what, we can't answer all these problems now, but this will help solve some of those problems of homelessness, of, showing how it could solve the future, right? Having the future in mind of decreasing these numbers by implementing something like this to get everybody on board of hey, we can help educate our kids and our parents. That way our future has a lot less of these problems as well. Would that be something, a good route to go down?
Is that a question for me or?
Yeah, either Robin or yourself, Bill. As far as getting everybody to rally around one specific thing to help solve a litany of issues? Like, would that be a great route to go?
I don't want to presume that everything's rainbows and skittles all the time, and solving one problem will solve all solving one challenge will solve all problems. What I think I'm arguing is that we need a seat at the table. This is every bit as much of a problem as other problems, public health problems we face, social problems. And if we're not talking about physical activity, that incidentally has the planning process will have lots of spillover benefits, then we're not talking equity. And I think it'd be like trying to reduce lung cancer incidence without having smoking cessation people to table. I think it's just not realistic. And I think the science around physical activity, from individual behavior changes to environmental policy changes and so forth, helps us demand a seat at the table. And oh, by the way, this might help solve other problems as well. One of my favorite things is this little pandemic that we've been in the last couple of years. Robin talked about competing interests, and lots of people say, well, we've got more important things to deal with. We've got COVID-19 to deal with. And I dropped a lot of my physical activity work for the last couple of years to try to help, as an epidemiologist, help address a pandemic response in the state of Texas. I thought that was appropriate, but I don't see it as an either-or proposition. In fact, there are now data that show that people who are active have a lower prevalence of hospitalization, even if they are infected with SARS-CoV-2, and serious disease if they are more active. And so now we've solved a couple of problems if we can get the attention of the medical community and infectious disease people to be thinking about promoting health and physical activity and helping lower the risk of severe COVID. So I guess my point, it's a long answer to a very precise question. I think we need to be at the table and having these discussions and showing how, for example, city planning that can improve physical activity can also improve some social issues and reduce health disparities in access to other things is absolutely critical. Great.
Well, we've got to move on with our agenda. So, Amy, I'm going to paste a webinar that was hosted by the Physical Activity Alliance recently on framing physical activity from a health equity perspective. It was a great webinar, and we're seeing if we can kind of host something similar there that could kind of short-term answer your question, since we have to move on with the program. But thank you, Dr. Kohl, for that great presentation. Thanks again for your support of us on the local level, and thanks for all of your work on the national level. We'll look forward to all these updates. It's great to see when objectives have been met. So we really appreciate it.
I hope your day is productive, and I'm your biggest cheerleader. Even though I don't look like a cheerleader, I am your biggest cheerleader.
Great, thank you.
Have a great day.
Great, thank you. All right, so next item on the agenda is the summary of what we've been doing specifically over the past 2 months. So we've hosted, as part of the lead up to this event, this summit, we've hosted 6 sector-specific special events. And we're going to give you highlights from each of those sector events, very quick highlights right now. And there are recordings of all these events available on our YouTube channel, which Katie, maybe I'm putting her on the spot, but hopefully she can throw those in the chat. And then also on our website, we have kind of newsletter summaries of each of these events as well. So as I'm putting Katie on the spot, but hopefully she can find those and throw them in the chat at some point. So we will now go around the room. So let's see, who is doing the early childhood summary?
Rhonda.
Rhonda Erpelding, can you unmute yourself and just tell me when to advance the slide?
And
of course, introduce yourself. Yeah.
I'm Rhonda Erpelding from Harvesters, and I am the lead on the early childhood sector. We held our special event last month on August 25th during our normal sector time frame meeting, which is always the fourth Thursday of every month. We welcomed Eric Willis, who is a lead data analysis from the Center for Health Promotion and Disease Prevention at the University of North Carolina. He has been really instrumental in further developing the Go Knapsack online tool for early care and education, which helps to promote best practices around child health practices. This platform supports various implementation and integration approaches based on individual state initiatives. And some states have initiated this tool into their quality rating system, as others have utilized features such as self-assessment and professional development through regional pilots or individual program-based usage. Go ahead.
Okay, trying, just a second. There you go.
Great. So just a quick overview of this tool. It's an online tool for early care and education programs, as I mentioned, to promote child best health practices within their setting. Things that we really enjoyed about the presentation is the ability that this tool will be able to enhance the work of the early childhood sector for physical activity. One being that we're able to obtain state level data from early care and education programs in both Missouri and Kansas. And also this data can drive stakeholder discussion, including regulation changes and possible funding opportunities. We can go ahead and watch a small clip from the presentation.
Hey, Robin, the sound isn't working.
Sorry if there were you couldn't hear that presentation, but I'll try to get that fixed for the next one. Okay, thanks, Rhonda. Okay, the next one is the healthcare sector. Who's doing the healthcare updates?
I am.
Okay, is that Jody?
Yep, can you hear me?
Yes, hi, Dr. Dickmeyer.
Hi there. All right, so I'm going to talk about our healthcare sector meeting that we had with Dr. Lisa Bailey Davis. We had this at the end of August, and she comes from Geisinger Health Center, which is in rural Pennsylvania. She's a registered dietitian, and she leads multi-level research for obesity prevention and treatment and has published over 60 related papers. Currently, she's leading a comparative effort to help with healthcare screenings in their healthcare system. The reason we love this so much is that we are also trying to do this in our healthcare system at Children's Mercy. So we really wanted to pick her brain a little bit and see how they're doing this. And then you can go ahead and advance the slides. So they use a 20-question screening tool, and they do it in 24 different clinics from 2 years old to 12-year-olds. They do nutrition and physical activity questions. They have a 54% completion rate, and that can be done either before the exam or in the exam room. And then the physicians or providers are able to see those results before they go into the room. They also have questions about whether the parents want to discuss anything in clinic. And so about 33% of those want to discuss a topic, including sleep, food as a reward, and sugary drinks as the most popular topics. What we liked is they've been doing this for so long. So they started this in 2013. and it's also embedded in their EMR, which we are doing ours in our EMR as well. They say adoption among providers is high. They like to see the results before they go in the room. The tool only takes 2.5 minutes to complete. And like I said, they can be completed either before the visit or in the exam room. Again, if you want to play
we're trying to follow this integrated framework for the prevention and treatment of obesity and other complex public health concerns by thinking about how we can engage the parent and the child with clinical care delivery and community systems, so that we're not working in a vacuum, but working to understand the community context of where people live, and maybe, you know, the services that they're receiving in the community that are aligned or affiliated.
So that was part of our healthcare talk that we had. And again, you can find that on the YouTube channel.
Great. Thanks, Dr. Dickmeyer. Okay, next up is Parks as a Community Wellness Hub from the Park sector. So Jen, are you presenting for this one? Is that correct?
No, I was going to go ahead and do it.
Okay. Yeah, go ahead. Sorry. Yeah, sorry.
Okay.
Jen. Yeah, go ahead, Katie.
That's okay. Probably a little brief, but so the Parks and Recreation event was held on Wednesday, August 31st, and it was at our normal sector time. We welcomed Tiff Coonan and Maureen Newman from the National Recreation and Parks Association. So Tiff and Maureen serve as senior program managers, supporting the concept of community wellness hubs in park settings. And community wellness hubs are built off of the existing strengths and assets of local agencies, focus on solutions that address the root causes of health and social inequities to advancing health and well-being. You can advance the slide. So kind of same thing. So the community wellness hubs are essential to health and well-being. They remove barriers and bridge gaps to help people across sectors access vital health and societal resources. There are several dimensions of well-being that make up community hubs, including cultural, economic, emotional, environmental, intellectual, physical, and social. Equity is at the center of NRPA, guiding the framework for action and elevating health equity through parks and recreation. And something that we really liked was what hubs look like in action, with an example spotlighting Bristol, Connecticut, Parks and Recreation Youth and Community Services. And you can play the video.
So this was a grant project funded in the Bristol, Connecticut Department of Parks, Recreation, Youth and Community Services. It was originally focused on increasing access to youth sports by planning for and installing a bike pump track for kids in the community. But as their project progressed and the pandemic really became a key part, the project started in 2019. As we moved into 2020, they realized that their role serving the community was just, again, organically expanding. So where they originally saw themselves as just, I say just in quotes, but program and sports providers, they were now hosting vaccine clinics, they were offering food distribution, offering childcare for essential workers. They were organizing duffel bags with arts and crafts, toys, games, so families who were quarantined could still support their kids' learning and physical activity.
Great, excellent. Thanks for that update, Katie. Next is the sports sector, and I can't see if Bill's still on. Is he on, Katie? Or Bill, if you're on?
I see him on.
I'm on.
Bill? Okay, Bill, yeah, go ahead. You're up, man. Unless you're driving or something.
No, I'm just getting going, so we're good.
Do you want me to give the update, or do you want to do it?
I will.
Okay,
Hi,
great.
everyone.
Go ahead.
So excited that we get to be together today. We were presented to by Dr. Julie McCleary from the university.
Well, Bill is about ready to head to Lawrence to meet with some guy named Bill Self. So so obviously that's a priority. But since he might be cutting out, I'll kind of jump in here. We had a presentation by Dr. Julie McCleary from the University of Washington. While there, she is the principal investigator for the King County Play Equity Coalition, and they talked about how they developed this equity coalition, and it's really kind of serves as a unifying body, an alliance body, if you will, for all the different youth sports organizations in King County, which is the Seattle area. And we really liked it for several reasons. One, I think something similar could be adopted in Kansas City. And two, that they really got people moving in a collective direction, which you're going to see from this video clip that we play in a second. And the last thing is that, you know, kind of the traditional way, the traditional sports pay for youth sports model is clearly not working for equitable access. And this is really kind of addressing that need. So here's Dr. McCleary.
The biggest thing that's happened is that our work has informed the work of the outreach and community initiatives of the pro teams. And it'd be better if they were speaking for themselves here, but I think they would say that, particularly the Kraken, who started when we started, have basically come to understand that the traditional model of pro sports, kind of like, we're going to do this high visibility splashy camp for free for 2 days, is not it. Right? Like, that's not going to get us to the systems level change we need. Like, you can hand out all the hockey sticks you want, but if kids don't have anywhere to play with them, like, it doesn't matter.
Yeah, that was just such a great clip. And in case you don't know, the Kraken is the professional hockey team in Seattle. So that's the hockey references.
The biggest.
Sorry. Okay, next is the mass media sector. So again, apologies, I can't see everyone. Is Melinda on? Melinda, unmute yourself if you're here. Otherwise, I can do. Oh, there you go.
I was double muted. Sorry about that. Yes. Hi, good morning, everyone. Melinda Shane from UMB. I'm the mass media co-lead along with Toriana Porter from the Kansas City Star. And on Tuesday, just this past Tuesday, we hosted special guests Lisa Tinchuin and Ekta Saxena from the Centers for Disease Control's Strategic Communication Team. Their topic was public health communication, considerations and examples to inform the KCPA plan. And you can go to the next slide, Robin. And during their presentation, they highlighted their work in audience research and testing methodology for public health messages and materials. And from their research and testing, they've developed several communication campaigns around physical activity. And they've made those available for free or low cost through a repository hosted by the State and Community Health Media Center. So those are things that on the local level we can take and customize for ourselves if we choose to use those options. And one of their findings from their most recent omnibus survey that we found interesting was when interviewing Midwesterners, they were less motivated by physical activity benefit messaging than other regions in the U.S. And right now we'll show a video highlight from this presentation.
On our most recent omnibus survey about physical activity, we asked a nationally representative sample the extent to which people are motivated by specific benefits of physical activity. Some of those key findings are listed on this slide. Of note, we found that Midwesterners were slightly less motivated overall by physical activity benefits messaging than other regions in the United States. We're sharing these with you today as examples of the types of questions you might want to ask about your local efforts to see what resonates with your audiences. We recommend doing additional audience research specific to KCPA plan audiences to see if there are other motivators for the audiences you are trying to reach.
Yeah. So, and I'll just say thanks, Melinda, for that update. You know, more to come on why us Midwesterners are less motivated by physical activity benefit messaging. So we're going to dive into that as we continue our work locally here. Last but not least is the school sector.
All right, Robin, I'm going to take over on this one. Thank you. Robin Stewie, and I'm one of the co-chairs for the school sector, and we wrapped up all the sector meetings by having ours yesterday afternoon during our normal meeting time. We welcomed Sean Brock, who is the Associate Director for Whole Child Health with the Alliance for a Healthier Generation. He leads the Healthier Generations work in physical education and physical activity at both school and out of school time sites. One thing great about Sean coming is he has an education background. He has been a teacher, physical education teacher. He has been an administrator, worked in community efforts. So definitely brought a wealth of knowledge for us, and we really enjoyed our time with him. You can move to the next slide. So as I said, it was yesterday afternoon, and we had a number of teachers who joined us, physical education teachers, and had a great discussion and really talked around the important roles of schools have in supporting physical activity among students. But we also, acknowledged and looked at the environment, the active learning environments, and the struggle to create more of that in the school setting. We discussed the comprehensive school physical activity program, but also really pulled into that there is no one size fits all. And I think that's important as community individuals, that we realize it needs to be an assessment of that school, that district, the building, each nuance that it brings, as well as how involved are parents and supportive of other teachers. So there's a lot of pieces that come into that. But one thing we really liked was that, and I think this resonates across all of the sectors, is really building that support with champion leaders. And then when it comes to schools, those students and family engagement, and then that community support to really aid that cultural change. So we can share this.
I would challenge educators in a specific school to say, all right, let's start with the end in mind. Think about this question. If all students at your school were more physically active, how would your school be different? And it's okay if you say, oh, it would be complete chaos. There would be kids that are out of control. My administrator would think that, I can't control my classroom. That's okay to get those types of responses, because those are the individuals that you're going to have to bring on board if you're really going to change that environment.
Great. Thanks for that update, Robin. And hopefully, I think we all were very impressed at the quality of the presentations that we had in these sectors special events. They were top notch across the board. There were a couple sectors, obviously we only had 6. We do plan on having some other presentations in the coming months for the other sectors that weren't represented. And they were such a success, though actually we're thinking about how we can have these as regular parts of our work because they were so valuable. So with that being said, I'm going to stop sharing my screen because we're running, about 8 minutes behind or so. So we're going to head straight into the breakout rooms. And I think that our breakout rooms have again already been pre-assigned. If you put your names in the chat, I believe we've resolved all those issues. If you're still having problems, you can chat with us. You probably won't get sent to a room, or you might get sent to the wrong room. Chat with us and we'll take care of that. We will plan on, even though we're a little late, we're going to try to end this session at 10:50 to get us back on track. Okay, all the facilitators. Okay, with that, we can head to our breakout rooms. Hello, everybody. I think we've all arrived back from our breakout rooms. So now we're going to begin a 10-minute break. And the first 5 minutes, we've got a physical activity break that we'll share. And then the second 5 minutes will be just a personal relief break, time to get a drink, go to the bathroom, things like that. Feel free to leave your camera on or off during the physical activity break, but we do really want to model good behavior. And so please get up, move around, stretch yourselves out. I promise you're going to feel better.
My name is Bryce from the Center for Children's Healthy Lifestyles and Nutrition at Children's Mercy, Kansas City, where we work to promote children's healthy lifestyles and physical activity in the Kansas City region. Today we're going to do some exercises and some stretches for you guys. Most of these can be done while you're sitting or while you're standing. So let's get right into it. The first one we're going to do, we're going to lock our fingers and we're going to stretch all the way up to the ceiling. Try to touch the stars. Get on your tiptoes a little bit, and then we're gonna bring our arms down, right behind our neck. Bring our elbows in, and let's rock back and forth. Right, left, right, left. Good job. All right, back up to the starting position, and now let's get some head circles in. You might hear some cracks, that's okay. Good, and now let's get our whole body involved and let's shake things out a little bit. Get ready for some of these main stretches. Awesome. Let's bring our arms up and we're gonna do some core twists. We wanna get a little bit of a wider stance. We're gonna go left, right. Nice rock solid. Perfect. All right, and all this can be done in a seated position as well. It would be this type of variation. And we're gonna move on to the next drill. So we're gonna do some knee pulls. We'll start with our right. You wanna grab right below the knee, pull up towards our chest, hold it for about 5 seconds. It's okay if you lose your balance, find something next to you, find a table or a chair. You can hold your balance just like that. If you're seated, you can do this variation. Back to our right leg. Good job. All right, and then we're gonna transition to some toe touches. Touch our right toe. Try to hold that for about 5 seconds. If you can't touch your toe, that's totally fine. Just touch somewhere in your shin. See how far you can get down. 3, 2, 1. Awesome. If we're standing, it's gonna look like this. See how far you can get down that shin. Try to touch your toes. Awesome. Nice and controlled. We can focus on our breathing in through our nose, out through our mouth. All right, we'll do a quick hamstring stretch now. Our right leg, we're gonna reach down, grab that foot, pull up towards our butt. Good, hold for about 5 seconds. Awesome, left side. 2, 1, good job. If you're in the seated position, it looks about like this. Get a good stretch in. If you're not able to grab your foot, that's okay. The variation would just be leaning back and trying to reach down with your hand as far as you can. Good. All right, on to the next one. We're gonna get a glute stretch in now. When we're sitting all day at home, this is a good stretch to make sure that things are activated. Our big muscles in our body are activated while we're sitting down. So we're gonna bring our right leg up, sit our ankle on our leg. We can lean forward for a better stretch, hold it, and then we can lift up on that leg just slightly. Good, we'll go to the other leg. If you're standing up, it looks something like this. Good, lift it up a little. Okay, and our last one, let's connect our fingers again. Let's reach to the stars. And let's slowly flow down into a forward fold. Grab those elbows. You can sway to the left and the right, left. Right, sitting down, looks like this. Left, right, okay, good. There we go, guys. Thanks for joining me. These are all exercises you can do at home. And as we're sitting at home, if you're working from home or in a seated position throughout the day, these are fantastic ways to get moving in an easily accessible way. Thanks.
All right. Hopefully that loosened you all up. We'll meet back here at 11 o'clock to start the breakout session number 2. All right, everybody, we're going to head back into the breakout rooms again. And hope you're having a good discussion. Just a reminder to the weighing in support and the facilitators, let's make sure that the breakout sessions are being recorded as well. The recording in the main room doesn't carry over to the
Man, we were having a really good discussion. Then we got kicked back here. What?
I know Donald had the best comment of the whole day, and then
He did.
right in between. Yeah. But solving all.
Yeah, you know, that's how it works. Like I had the most enlightening thing going, and then, you know, whatever.
Well, let's see, I'm looking, looks like everybody's back into the room now. So what we're going to do is do a share back to the entire group from each of the individual breakout sessions. So each group gets 2 minutes to share what you discussed. I know that is not nearly enough time, but that's all that we've got time today. There will be additional notes and reports coming out of this that'll be more encompassing, but this will just be kind of a little taste of what happened in the breakout rooms. So we'll start with access room number 1. And I think Jessica was the facilitator there. I don't know who's going to be speaking, but feel free to unmute yourself. And Jessica, if you're sharing a Jamboard or your screen, you can go ahead and do that now too.
Blake is sharing for our group. Blake, would you like me to share any particular screen on the Jamboard, or would you like to just share?
I think I can just share.
Okay.
So hello, everyone. My name's Blake. I'm with the Unified Government Public Health Department. So we talked about access to physical activity opportunities in our community. We had a pretty good group of people. We talked a lot about schools and also like early childhood development. We talked a little bit about engaging with our elected officials and just engaging the community to bring some of those safety concerns forward. At the end of our discussion, we did end up talking a lot about or a bit about safety and perceived safety and actual safety, and really also talked about just creating a culture of physical activity. So we talked a little bit about how like our parks are built. Maybe there is like a baseball diamond or something like that, and you feel like you have to play baseball in order to be in that space. So really talking about how could we talk to our residents and talk to families about you can be physically active in many other ways, just out in your community, and just understanding that will require some time in building trust and again, building kind of that culture of it's okay to be outside and maybe just ride your bike or walk around your neighborhood and do stuff like that. We also, those were the main things that we talked about. And we did talk a lot about local government. I think we had quite a few people in our group that was involved with that. And really just overall education and engaging with all groups of people. And just, yeah, those were our main points.
Great, thanks for that. Thanks for that summary, and it's interesting, and I think probably everyone is hopefully you're having the same experience I have. Is that we were talking about policy, but some of those same issues came up in our group around community or communication and partnerships, and so as we're hearing these updates, let's kind of think back to some common themes around them all. Access to physical activity was by far the #1 interest area as people registered. So we actually had 2 access to physical activity groups. So the second group was led by, or was facilitated by Zane. And I don't know who's speaking from that group.
I'm going to share my screen and invite Jody. Yeah, Jody.
Okay. Yeah. So we had a good amount of people from different from different sectors talking, and we definitely have some good collaborative work that we can move ahead with. We were talking about with Kansas City, we have a lot of opportunities because we do have some beautiful parks. We have some good bike lanes. We have a lot of sports teams in Kansas City and a lot of different activities that kids can get involved in. But we kind of had the same discussion, and we ended kind of in the same area with communication. Communication is hard to try to figure out what is accessible, what we have available, how our patients and family and friends can access these resources. So we kind of lumped our priorities into 2 different categories that can kind of be connected as one. So one of the priorities was creating the map of physical activity locations, gathering and distributing of program and resource information. So really this like side over here on the right, we really need to create our list, try to find our resources, talk with community health members and all the different wonderful organizations that you guys are involved in, and find that list, create maybe a central hub for that list where you can access it either in like a park facility or an online app or website, and then also how to communicate that out. So our other side of the priorities was communication. So talking with our leaders, getting feedback from Kansas City members as well to try to figure out how we can engage Kansas City into this priority as well, and then connecting the two. So how do we connect both of these to get the word out there?
Great. Awesome. Thanks. Thanks, Jody, for that update. Let's see, policy was next. So Julianne was the facilitator and Allison is going to give us a summary.
Yes. Thank you, Allison. Would you like me to share the screen, or are you good to go?
Share it. Share
All
on.
right.
The keynotes are
I will
beautiful.
share it.
A lot of good work into those.
Okay.
So crazy, Jody, you mentioned all that because we talked a lot about that. Just the Wellness Hub didn't come up. So messaging and communication, getting the word out there, and then also duplicate groups. We also talked about missing the people who need to be at the table to make those changes and just understanding what they actually want. We also talked about trying to get some of those city officials out there to also help us out in the decision makers and convincing them. We also talked about how different languages, back to communication, maybe some of the city officials are not speaking the same language as the community members that are actually requesting. And so they're misunderstanding what's happening. And then also not being aware of those resources. That was one of the other big things that goes back to communication, is who in your agency is going to these meetings to learn about all these offerings, and then what are they doing with that information? Are they taking it back to their work group and sharing those resources with people who can actually utilize those and take action? Staffing and funding, and people actually being able to make the adequate time to follow through on some of these actions as well too. But a lot of it came to communication, messaging, and understanding. And then we also had one on, let's see if I can go find it. Policy. Policy is hard, guys. A lot of us are not policymakers. And so then when those do come out, all the legal jargon and all that, like might be missing the mark on some of that. And then we're also having struggles with restrictions to those policies and getting those city officials to get to the table to understand why some of those policies need to change, so that way we can provide access for all. Did I miss anything? Anyone else in our group? Donald,
you may have mentioned it, Allison, but emphasis on, a coordinating entity for all of these things, that crosses state lines, crosses county lines, et cetera. Thank you.
Yep. Donald, you had a really good one at the very end.
You mean okay, so.
Yes.
So I was just saying, I think Allison brought up a point about having, one group is doing one project, another group is doing another project. We don't want to double dip. So it'd be great if there was a huge text group where we had all of our different partners on this text group. So when one sent out text, hey, I'm doing this project, someone else could be like, hey, I'm interested in that. I don't want to do it again. I'm hopping on, or something like that. That'd be awesome. I think that'd be awesome for all of us.
Yes, just sharing the wheels that you work so hard to create, so that way someone else can also duplicate that wheel and offer it in their area as well, in their community. So thank you, Donald.
Great. Next up, physical activity programming. That was Tina's group, or Tina facilitated.
I did. And I think, is it Chelsea? Are you sharing for us? And do you want to see the screen as well?
Yeah, you can show the priorities.
Okay, great.
So like all the other groups, we had a lot of the same conversations, even though we were programming, partnerships are key in order to successfully do programming. We need to have the partners that are focusing solely on physical activity, the partners that are focusing on other health aspects, but, fitting physical activity into their work plans and the priorities is really key. And there's some great partnerships already. There's some great facilities with Parks and Recs. And obviously this Physical Activity Summit has brought a lot of those people to the table, which is always a positive thing, and kind of breaking down those barriers for communication, which was another priority, is the communication piece. There's tons of great programming going on in the community, but sometimes the communication isn't widely distributed to everybody. There's a lot of different priorities in programming. So sometimes all that communication, if it's not your focus, it's lost. But finding the new and unique ways to get that communication out. We talked about newsletters and social media, and just the non-traditional ways as well. Another priority is, when you're talking about programming, is to meet people where they're at. It's great to have people come to a rec center, but if that rec center isn't accessible or that park isn't accessible for everyone, then sometimes that programming will fail. So really making sure that we're meeting people where they're at, and to engaging the other businesses or organizations in that community. We talked about, a grocery store that's a popular place, maybe a great partner to have, even though it's not physical activity, they can promote it. We can hold something at their grocery store that would promote physical activity. So all of those things, just inviting and inclusive, and meeting different languages. We talked a lot about signage and how having different signages within parks or community facilities would be great. QR codes that take you to a different website, or having signage in different language just makes programming accessible to all different types of audiences. And then beneficial, right? So meeting parents and kids all together, all different ages. And, I think that's about the key things. And really, the last piece would be the innovative programming. Thinking outside the traditional activity, walking, gym, really trying to come up with some innovative, engaging programming. COVID obviously has allowed people to become very comfortable with the online world and doing things virtually. So how can we kind of still capitalize on reaching audiences using that method, as well as having, those central locations and parks and things that we can reach people at. So I think that's about it. And obviously there were several other conversations, but those were the key things we talked about for priorities for programming.
Great, thanks Chelsea for that update. And last group to share is professional development education. Sai was the facilitator there.
Yeah, and I think James was going to share for our group. James, would you like me to share my screen, or are you comfortable where you're at?
Yeah, if you want to share that kind of last slide, I think we can go over it from there. Yeah, so my name is Jay Robertson. I'm one of the sports medicine docs at Children's Mercy, and we're basically talking about different ways to educate amongst our groups, and even down to families and kids. And what we kind of decided was that there's got to be some collaboration amongst the different sectors to really find out, make sure we're really educating the right people, the people who want the education, and making sure that we're tailoring the education to whatever group we're talking to. And as I've seen, communication and different language kind of becomes a theme in different ways, I think, for all of our groups. But one of the things that we're really talking about is making sure that we aren't using jargon when we're talking to people, making sure we're using basic language that can educate everybody without people being confused or unsure of what acronym we're using and things like that. And that's something that needs to happen regardless of what group is being educated. But I think we've got within our whole KCPA plan a lot of highly educated and engaged folks who would be great resources to provide education. So I think that's where we've got some really good strengths in this group, and just making sure that when we do those implementation things that we do bring in the different sectors. Also, a big part of education is making sure people can actually get to it. So making sure that we give plenty of different opportunities, whether it be in person or online or on demand kind of education that we can get everybody involved with. And obviously different parts of our states and different parts of the region have different access to those things. So we really want to make it accessible to all. It was a really big point that we wanted to make. And then another thing that we really wanted to make sure is that we could engage leaders in the organization. So in a business or in a school district or anything like that, to actually give people the time to do this and talk about costs and how to mitigate that for the individuals and maybe get it onto the group. So that's most of what we were talking about.
Great, thanks, Jay. Thanks to all the groups for great summaries. Thanks to all the individuals for participating in the conversation. Obviously, that was just a snippet of what happened in all the breakout rooms. So we'll spend the coming days, weeks, and even months, really kind of better understanding what some of the themes and takeaways were from all of these breakout sessions. And that actually leads us to the end of the program and the next steps. Pull up my slide here. Sorry. So we've been recording all these sessions. We've been taking excellent notes. Of course, we have all the Jamboards from the individual presentations, and we're going to distribute all that information back to you, like I mentioned. We'll do that in several ways. One way is we do have a Kansas City Physical Activity Plan YouTube channel, and Katie might be throwing that in the chat if she hasn't already. This is where we have recordings of all those special events that we held in August and September, in addition to where we'll post some of the discussions that we had today. We also really try to prioritize communication through sectors that you've signed up for. So there are monthly sector newsletters that provide really good summaries of the things that we've talked about. And I'll show you in just a second on how to sign up for those sector updates and that communication in just a minute. And that brings me to, we hope that you join a sector working group. This is where the action of the Kansas City Physical Activity Plan really takes place, is at the sector level. And so the easiest way to be involved and to help with collaborative action across the plan is by getting involved in your sector work group. We'll show you on the next slide how to do that, but I strongly encourage you to sign up for one of those groups so you get those communications. Additionally, if you don't want to join the Kansas City Physical Activity Plan, if you don't want to join a sector work group, that's fine. This plan is a free plan. It's a publicly available plan. We would be ecstatic if we learned that some organization or some group all of a sudden went ahead and implemented strategies 24, 25, and 26 because they were part of some other working group from some other organization and were able to do it. That is what we want to do. Because if we get enough people implementing the plan, we feel we can make long-term changes in opportunities for physical activity in our region. So here are the upcoming sector work group meetings. So early childhood, healthcare, parks and recreation, sport, mass media and schools all have dates set. We have a couple other sectors that currently don't have meetings set, but will. But again, if you sign up for sectors, you'll get notified of when those future meetings happen. And again, Katie, I think, has put in the chat how you can sign up for those groups. And actually, it's on the screen right there too, KCPhysicalActivityPlan.org/sector work groups. And with that, that concludes the 2022 Kansas City Physical Activity Summit. We're only 1 minute over. Thank you all for all of your work today. Thanks for joining the conversation, contributing to the conversation. We really appreciate it. And most of all, thank you for all you do for health in our region. And with that, I hope you enjoy the rest of your day and that we see you in a future sector work group meeting. Thanks, everyone. Have a good day. Oh, sorry, last one. I screwed up. Eval. This is the last slide. So we'll leave with this slide up. Please contribute. We do take your evaluations to heart. So please, if you have comments, not only about today's summit, but also the work in general, feel free to fill out this evaluation. And we look forward to hearing from you. Thank you.
Bye, everyone.